Hello friends, in this lesson we will be learning about ear infection treatment. What is ear infection? An ear infection happens when germs like bacteria and virus get in your middle ear and cause trouble. An ear infection is most often a bacterial or viral infection that affects the middle ear, the air-filled space behind the eardrum that contains the tiny vibrating bones of the ear. Children are more likely than adults to get the ear infections. How can you get that there is an ear infection? There are many symptoms like ear pain, fullness in the ear, hearing loss, ringing, discharge from the ear, vomiting, and vertigo. Common ear infection symptoms in infants can include unusual irritability, difficulty sleeping, tugging and pulling at one or both ears, and fever. When an adult develops an ear infection, he or she may develop symptoms such as ear pain, hearing loss, dizziness, or a feeling of blockage in the ear. There are some natural pre-treatment of ear infection. First is garlic and mullein ear oil. Garlic and mullein are the most popular herbs used in treating ear infections. You can find pre-made garlic and mullein oil at your local health food store, or you can steep crushed cloves of garlic with 1 cup or mullein infused olive oil. 3 drops should be applied to the ears 2 times a day or as needed. Next is warm compresses. Warm wash clothes placed over the ears can help with ear pain. Next is echinacea. It helps provide immunity and reduce the amount of time of your ear infection. Let's see some treatment of ear infection. First is a warm compress that we have seen already. Next is pain medication. Your doctor may advise the use of over-the-counter acetaminophen or ibuprofen to relieve pain. Use the drugs as directed on the label. Because aspirin has been linked with Reye syndrome, use caution when giving aspirin to children or teenagers. Although aspirin is approved for use in children older than age 2, children and teenagers recovering from chickenpox or flu-like symptoms should never take aspirin. Next is air drops. Prescription air drops such as antipyrin benzocaine may provide additional pain relief. To administer drops to your child, warm the bottle by placing it in warm water. Put the recommended dose in your child's ear. Benzocaine has been linked to a rare but serious, sometimes deadly, condition that decreases the amount of oxygen that the blood can carry. Don't use benzocaine in children younger than age 2 without supervision from a healthcare professional, as this age group has been the most affected. If you are an adult, never use more than the recommended dose of benzocaine and consider talking with your doctor. We can also prevent ear infection. Preventing ear infections begin with understanding the risk factors that increase the chances of developing them. Risk factors for ear infections include exposures to cigarette smoke, allergies, and certain birth effects such as Down syndrome. Suggestions for preventing ear infection in children include educating yourself about the common symptom of ear infections and not smoking around your child. This was the discussion about ear infection treatment. Thank you.